Good morning. I'm Dave Warren, and I'm a clinical herbalist at the New Mexico Herbal Clinic located in Taos, New Mexico. Today, I want to talk to you about antimicrobial herbs. And when it comes to fighting off infections and warding off looming illness, antimicrobial herbs will be among your very best helpers. They contain compounds that directly deter pathogenic bacteria, fungi, viruses, and protozoans. And you'll find that antimicrobial herbs are valuable remedies for things like the common cold, the flu, and manageable mild to moderate infections. And I want to pause there for a moment and go over that last part again. Manageable mild to moderate infections. You know, if we have a raging infection going on in our body, we need some medicine that's going to react quickly. And in that case, you need to see a physician, and you need to see them relatively quickly. Infections can get out of control very, very quickly. However, for mild or moderate infections, herbs are a great way to go. Now, depending on the type of the infection, antimicrobial herbs are applied topically or taken internally, and in some cases, both applications can be beneficial. So I personally keep a reserve of these herbs in my apothecary throughout the year, but I also take special care to stock up in preparation for the arrival of the cold and the flu season. And we're just coming out of February right now as I'm recording this and going into March. So we're coming towards the end of that cold and flu season, which means that I actually stocked up sometime back in late fall. And you should do the same. You should always have these antimicrobial herbs in your medicine cabinet. Now, if we talk about these herbs, I need to preface it by telling you that we're only going to discuss 5. There are so many more, but these 5 in particular are good. So if we discuss these herbs, please understand that everything we tell you needs to be taken and discussed with your doctor or a clinical herbalist to make sure that there's no contraindications between any pharmaceutical drugs you may be taking or any other illness you may be experiencing at the time. So let's keep that in mind, okay, because that's a really important point. So it's important to realize that herbs aren't always the only support you need to combat infections. Antibiotics and conventional medical care have their place, very especially with young children, and as we said above, with serious infections. So young children should never be given any herbal remedy without first consulting your doctor or a certified or bona fide clinical herbalist who can understand how these herbs interact on a child's systems. So please keep that in mind. And this particular video is designed to be introductory in scope, and it doesn't fully cover each medicinal herb that we're going to discuss. If you plan to forage for any of these herbs, with the exception, of course, of golden seal and white sage, which are threatened species and should never be gathered from the wild, you will need to seek out really good identification tips. You also need to learn foraging ethics and guidance before you harvest any plant from the wild. You know, I tell people this all the time. There are a lot of deadly poisonous plants out there, so proper identification of what you're foraging for is vital. So with that said, let's get on to the 5 herbs that I think everybody should have. And the very first one is going to surprise a lot of you. It's Japanese honeysuckle. So Japanese honeysuckle, you're going to be using the floral buds, the open flowers, the stems, and the leaves. Pretty much everything except the roots. And to prepare this, you can do it in several ways. You can make a herbal tincture, an herbal decoction, an herbal infusion, honey, syrup, poultice, a douche, and a compress. So what are the actions that we can expect from Japanese, honeysuckle? Well, it's antiviral, it's antibacterial, it's antifungal, it's an it's a bad morning, immunostimulant, it's a decongestant, an expectorant, an antioxidant. Let's see what else is. Oh, it's a diuretic. It's an astringent. And it's anti-inflammatory. So Japanese honeysuckle has an awful lot of herbal actions going on. And I would venture to say that many of you are acquainted with the blooms of this vine, and you've probably as a kid or maybe as an adult, taken a little lick of the nectar straight from the flower's golden tubes that run down it. And you'll be happy to know that some of those herbal actions I just mentioned, you can actually get by doing that. So if you see your kid taking a lick off those little golden strands in the honeysuckle flower, it's fine. That won't hurt even a child. So Japanese honeysuckle flowers are powerful, very powerful antimicrobials, and are one of the most widely used medicinal herbs in the world. And honeysuckle can be used internally, as we said, as a tea or tincture, externally as a poultice or even a wash. The floral buds, that's the buds, right before they open, and the open blooms are immune stimulating and strongly antibacterial and antiviral. So, if you're in Chinese medicine, you can use the flowers internally to address what they call hot, inflamed conditions, head colds, flu, urinary tract infections, or UTIs as they're commonly known, laryngitis, mastitis, sinus and ear infections, and lower respiratory infections. The flowers can be gathered as buds and as open blooms and tinctured in fresh alcohol. And we talk about alcohol and tinctures. It's really a good idea to use organic grain alcohol. A lot of other alcohols have some additives put in that we really don't want to see. So always try to use 100% organic grain alcohol, okay? Honeysuckle is also very effective as a tea. And at the clinic, we combine it with mint and lemon balm, which is also a mint. So basically, we're talking spearmint or peppermint and lemon balm, because honeysuckle as a tea can be a little bit bitter. And we found that mixing it with some mint and some lemon balm draws off that bitterness. Now, there are a lot of species of honeysuckle, and many have been used medicinally throughout North America, Europe, Asia. However, the traditional use and the part employed that we've discussed earlier varies among species. And the biochemistry of the genus is also variable. For example, some honeysuckles have poisonous berries, and some have leaves that can cause vomiting and diarrhea. So once again, that foraging, that gets a little bit tricky if you don't know exactly what you're doing. And so always consult with a herbalist, preferably a clinical herbalist who knows not just the herbs, but the body and the systems of the body and how everything interacts. So that's just a word of warning. So, because of that, we can't make a broad speculation about the medical quality of the entire genus, obviously. And so, here we're just talking about Japanese honeysuckle. So, please don't use this information for other species of honeysuckle. And just to put it into context, the vast majority of honeysuckle that you find locally across North America is going to be Japanese honeysuckle, but not all of it. So just a word of caution there, because that is really, really vital.